generating solutions or figuring out what can I do to address this problem. And the NCLEX might phrase this as which interventions are indicated or not indicated, or maybe which actions would address that priority problem we identified, maybe which actions would worsen the priority problem, because that's always a risk, is that something we do could make it worse. And so I want to point out that your ability to answer at this part of the case study depends heavily on your understanding of the content. Because if we at this point didn't know why this patient was short of breath, I wouldn't know what to do for him, right? Because if he was short of breath from pneumonia, I'd give antibiotics. If he was short of breath from a PE, I would give heparin. And we'll talk in a second about if he's short of breath from heart failure, what we would do. But it is important that you can understand what's happening with the patient so you know what you need to do to fix it. And so that's why all of our case studies have this kind of built-in content review video at the end to teach you this content and have that kind of content review to prepare you to clinically think and generate these solutions. So let's look at step 4, where we need to select whether each intervention is anticipated or not anticipated. And so let's take these one at a time. Do we need to get blood for a blood culture? And let's consider this at the same time as number 2, sputum for a sputum culture. I don't see any guesses for blood for culture or sputum for culture, and that's because this would be indicated for what problem that we suspected. This would tell us if we had an infection present, right? We, again, don't have a fever, don't have a white blood cell count, we don't have yellow-green sputum. I don't think this is an infectious problem, and stopping to do these things is just going to waste time and be a waste of resources. All right, next, do we need to prepare for an echocardiogram? And this is how the NCLEX likes to test whether you know what a procedure is indicated for. Do I need to do it for this patient or not? And an echocardiogram, if you guys have never had a chance to see this, it's pretty cool to watch at the bedside. But the patient turns onto their left side, and then it's just an ultrasound that visualizes the heart and its valves, and each pump of the heart, you're able to see blood leaving each of the 4 chambers. So this is used to tell us about the heart function, and we can actually visualize, is the heart weak? Is it, are the walls thickened? And do I have some obstruction or valve problem? And so yes, this is gonna tell us the severity and presence of heart failure. Then do I need to draw serum renal function tests? And this is just a fancy way of saying a metabolic panel, right? Either a basic metabolic panel or a complete metabolic panel. That's going to tell us our BUN, our creatinine, and then all of our electrolytes. And so not only is it important that we look at the BUN and creatinine to see if he has an acute kidney injury happening, but we also need to look at some of the electrolytes in anticipation of a medication that you guys, some of you remembered we might be giving. So yes, we do need to look at his renal function to figure out if there's kidney damage and if we can safely give some meds to treat the fluid overload. Then administering supplemental oxygen, I am going to go ahead and answer yes for this one because I think you guys know that somebody who's got a pulse ox of 89%, unless they have COPD, needs oxygen. So yes, this is anticipated. Then get a 12-lead electrocardiogram. Yes, just like with the echocardiogram, this is going to tell us, is this heart rate high because he's in atrial fibrillation? Or could he be having an MI? Sometimes having a heart attack, he doesn't have any chest pain, but patients with diabetes don't always have chest pain, do they? So if he was having a heart attack, that can actually cause heart failure and cardiogenic shock, a really severe form of it. So I definitely want to get a 12-lead EKG. And then here's another lab. Do you guys know what this one measures? B-type natriuretic peptide, or BNP. I want you guys to tell me, what does that measure? It would be elevated in heart failure. It would also be elevated in kidney failure because this is measuring fluid overload. So BNP is released from your heart whenever it's stretched from fluid overload. So yes, you guys are right. So for this guy who's having shortness of breath, I'm going to of course, put on oxygen first, right? And then do my most urgent things like getting the 12 lead, because if he's having an MI, I need to get him to the cath lab. So I'm going to do those things quickly, stabilize him with some oxygen, get a 12 lead, and then draw my labs. And at some point, someone will come for an echocardiogram. And then when we get the results of the renal function test, we'll know if we can safely do the next step. So let's see. You guys are doing really well.